If you're someone who supports or teaches others, I'm here to give you 4 reasons why trauma-informed practice is relevant for you. And this is regardless of if we actually know that trauma is present or not. My name is Kizzy and I'm a mental health and trauma speech therapist with lived experience of severe mental distress and complex PTSD. Reason number 1. We never actually know if trauma is present or not. And I know that most of us might already be aware of this, but we still tend to make judgments about people. There are some people who you can genuinely see are struggling, and others who really do just seem to have it all. They have it all together, they are always on time, they seem to always be happy and bubbly and see the positive in everything. But even those people that you think could never possibly have experienced anything bad may have. I know because that was me. No one would have thought that I had experienced complex, incredibly distressing trauma as a child, and for many, many years. I was also suicidal every single day throughout high school, and I recently bumped into a high school teacher who was really quite caring towards me, who told me that she could never have been able to tell what I was suffering from. What she thought was that I was just a quiet and very mature student, which is how I presented to pretty much everyone. So, you really just don't know what people have been through. That is the first reason. And now we enter into reason number 2, which is around perceived differences in society. So the people that we support, in particular, if you're an allied health professional or you're an educator working with people who have complex needs or differences, these differences are generally not always treated so well by the rest of society. Perhaps a person goes into the community and they don't receive the same access as other people. They may be bullied, they may be teased, they may be socially isolated, especially at school. They may experience more breakdowns and more misunderstandings than other people. And these are all incredibly stressful situations. And what we know about trauma is that it's the result of prolonged exposure to highly distressing or stressful situations, in particular without that consistent buffering, connected, securely attached adult. So this can be applied to any other situation in other allied health, like occupational therapy, physiotherapy, acupuncture, and of course different parts of education as well. So that is reason number 2, that these differences can increase the risk of developing mental health and trauma. Now, reason number 3 is obviously about the pandemic. We all have just come out of, or some of us haven't really come out of, a global pandemic which has been traumatizing, because trauma is the result of prolonged exposure to stress. We all go through stress. We all go through high levels of stress, but for most of us, they happen in short bursts. And even when we go through something stressful, we generally have a loved one, especially as children, who can help us, comfort us, soothe us, and allow us to calm again, our nervous system to regulate, and for us to then move forward. But for some people, that isn't possible for lots of different reasons. And that means that their nervous system remains in an activated state. Maybe they've been through a prolonged lockdown. Maybe they've gone through several distressing events that's happened within their family. Maybe they don't have that securely attached caregiver to help them soothe, in particular, again, if they're a child. So pandemic is the 3rd reason. Now, the 4th reason is directly related to our ability to teach others, other people's ability to learn from us. And this is about the brain. When we have experienced trauma, when we're in a state of survival, fight, flight, freeze, collapse, which is a trauma response, what that does to the brain is it shuts down the thinking, learning part, which is this whole front part where we do our decision making, our problem solving, our logical thinking, where our personality is, where we remember things. That actually shuts down when our brain thinks we're in danger. We might not physically be in danger, but the brain senses when we have a stress response And that could be a physical type stress response or an emotional type stress response, and it thinks, oh no, we're in danger. I'm going to put you into survival mode, because of course survival is going to be prioritized, which means we don't need to do our complex thinking and learning anymore. We need to focus all of our energy on the survival parts of our brain, which are these lower, sometimes called more primitive parts that control things like our heart rate, our breathing, our adrenaline, our sweat, our muscles, getting us ready to go. By the way, it's not always obvious. Sometimes, I mean, if it's a fight-flight response, then yeah, you can usually tell it's these big behaviors, right? It's this, maybe it's that screaming, or it's the running away, the avoidance and all that kind of stuff, the saying no, no, no. Sometimes though, you can't actually tell someone's having a trauma or survival response. In particular, if it's more of a freeze collapse type response, which can look more like going rigid or shutting down, or becoming really tired. And sometimes we can also interpret the fight flight as poor behavior, right? In fact, that happens quite a lot, when actually it could be a survival response as a response to a trauma trigger that we might not be aware of, but in their brain relates to something that has been distressing or considered dangerous for them in the past or in the present. The reason this is important is if we want to teach others, we need to ensure that their thinking brain is actually online. So there are trauma-informed principles and brain-based, bottom-up brain-based approaches that will allow us to address this, so that we can actually ensure that we're teaching others effectively and they are able to engage in meaningful learning and growth with us. In the next video, I'm going to go into some of these crucial trauma-informed strategies that are going to allow your students, patients, or clients to actually fully engage and learn with you, so that they can grow and reach their potential. And this is regardless of if we actually know that trauma is present or not. It will benefit everyone. So subscribe for more.